Hello friends and welcome. I'm Sarah Clute-Bain, Executive Director of the Boone County Hospital Foundation. This year's Harvest Festival is truly special. We're celebrating 125 years of Boone County Hospital serving our community with compassion, innovation, and dedication. Supporting the foundation means being a part of that story. It's a gift that lives on well beyond ourselves. Thank you so much for being here tonight. We appreciate all you do for the Boone County Hospital and the foundation.
I'm Michaela Kienitz, the Chief Executive Officer at Boone County Hospital. A lot of people don't realize this, but EMS isn't mandated the way police or fire services are. That means that in many parts of Iowa, ambulances don't always show up because there isn't a service available to respond. We're fortunate here that Boone County Hospital has made EMS a priority. It's about peace of mind. When someone calls 911, whether it's a heart attack, an accident, or anything else, they just need someone to show up, and Boone County Hospital is going to keep making sure that that happens. Tonight, that's where you come in. We're raising funds for a brand new ambulance, a critical investment that will keep our response times fast, our care advanced, and our community safe. Every dollar you give tonight helps make sure that when someone's loved one needs us most, we're ready to roll. We are so grateful for the incredible generosity of this community. Your support means everything. It's what allows us to keep showing up, to keep saving lives, and to keep delivering care when and where it is needed the most. Thank you for standing with Boone County Hospital and helping us continue this life-saving work.
I'm Mark Addy. I'm the Director of the Ambulance Service here at Boone County Hospital. When I started, the call volume was about 2,400 calls per year. Since the last 12 years, we've grown to 3,400 calls per year, which is a dramatic increase in the call number. And that puts quite a strain on the department as well as the apparatus that we use. The cost of a new ambulance currently is about $280,000, and that doesn't include any of the equipment, medical equipment inside. Our goal is to get us on basically a 4-year replacement schedule that we will buy a new ambulance on year 1, and then on year 5 we would do what's called a chassis swap. They just take the box off, we buy a brand new chassis, put the box back on, and that is about $100,000 less because we're just replacing the chassis. Things are challenging all over right now as far as funding. As a department of the hospital, we have to figure those things out and figure out how we're going to continue to provide high quality service with decreasing resources.
He was coming up for a car part for his Pontiac Grand Prix, and he was been looking for it on Facebook Marketplace. So we were actually supposed to meet in Dayton, Iowa. We decided to make a day of it. Just, two little 18-year-olds doing a little road trip for the day. We had that kind of like the slower stop to the stop sign, and then just started proceeding through it, and I can look to my right and I see the grills of the truck.
I don't have any memory of the time period. It goes back months before the accident. It's all gone. It's hard putting pieces together, following to think what I would have thought in that moment because I know myself as a driver and different things like that. The biggest assumption is that I thought it was a 4-way stop. It's the easiest to make because it makes the most sense to me.
We were called about 5:30 in the evening. It had been a busy day. Both crews had been out most of the day. Myself, we were on first crew with my partner, Jason Carlson, as well as Tammy Weir and her partner, Josh Peak, that day. We were all back in quarters discussing the calls of the day when a call went out that sounded especially bad.
Since he wasn't wearing his seatbelt, he was ejected from the car, and I stayed in.
We were actually the second crew, so we were the PM shift, so we were supposed to be sleeping. But it was an unusually busy day, and we've been woken up a couple of times. So we just dropped a patient off at the hospital, and we're going back into the ambulance room to drop off some paperwork and trying to get back to bed when we heard the call come out. And as we were listening to the dispatch come out, we're like, they're gonna need a second truck. We heard possible ejection. We can't go back to bed.
En route, we hear both the fire department and the Ogden first responders get on scene, who immediately tell us that it looks pretty bad. So I call for 2 helicopters, one on standby and one to go to the scene directly. One more call had come out from the head of Ogden first responders. He said at that time he thought the ejected person had died. By the time we got on scene, it was pretty obvious that the white vehicle had rolled over at least once, if not multiple times. I was looking for the ejected patient. So I make my way around to the outside north side of the vehicle to find the patient more or less about 15, 20 feet behind it. I yelled out to the closest first responder, happened to be Mark Dorr at the time, saying, hey, we have a very serious situation here. I need to stabilize this patient first.
On the way down, we were talking about who was gonna go where. I had taken the call previously, so Josh was like, hey, I'm gonna take the person in trap. That's probably who's gonna be worse. And that was Brittany.
I can remember seeing like the cracked windshield and just kind of like the dazed of what happened, where am I? And the next time I woke up was with my EMT and I was being loaded into the ambulance.
We went ahead and what we call getting a patient trauma naked. So we unfortunately had to cut off all her clothes to see what we could see. Her injuries weren't physical, they weren't gnarly at all or in any type of way, but when I turned to get into the ambulance, I looked back and I did see Josh and Jason with Dylan on the ground, and he was doing what we call decorat posturing, which is pulling the arms and feet in, which I knew was a bad sign. So I was really worried that if he's that bad, what's going on with her that we can't see?
He was kind of drawing his hands up to his chest and pulling his knees in, which is a very bad sign in a possible head injury. I considered that to be, I needed to move quickly and prepare to intubate the person because they're probably not going to be able to maintain their own airway for long. And by then he's starting to fight. So Mark is helping me stabilize and get a C-collar on him while I continue to lay him back, start giving him medications to prepare to initiate what we call an RSI, rapid sequence intubation, which is a paramedic level procedure where we have to induce sedation as well as paralysis so that we can safely pass an endotracheal tube into the patient's trachea and then therefore breathe for them.
Brittany's coming too, and she's not happy that we're touching her, not happy that we're by her, so I have to calm her down. And it's one of the things that partners that work with me say I do really good at communicating to the patients, explaining things in terms that they can understand, trying to help calm them down. And I finally just talked to her and let her know who I was, what we were doing and why we were doing it, that she was in a car accident because she couldn't really remember. And then she kept asking about her boyfriend, and I said there was other people with him and not to worry about it.
Once we got the airway secured, the helicopter landed right about that time. We had to move kind of quickly, make sure that everything was locked in place and that he was backboarded. Checking his initial assessment, I found that he had definitely the signs and symptoms of a broken collarbone and possibly a shoulder out of socket and possibly a fracture to the lateral side of his hip. So I was concerned about multiple different fractures and blood loss. So I did start him on some fluids and tried to start giving him some volume resuscitation as well. I also gave him a painkiller after I finished the intubation.
I've been told a lot of stories and pieces have been put together to know that Josh, a paramedic that was on scene, I know he did a lot. There was the assumption that I was deceased, or that they declared I was deceased real early on, and he just had that gut feeling, which ultimately saved my life. I think it was him that called for the life flight for me, and they got there pretty quick. They took me to Methodist in Des Moines, and then I think from there to Omaha.
About that time, we got one IV started, I did, and my partner got the other IV started so we could start pushing some fluids in her. We knew for sure she had to be losing blood from somewhere. Her blood pressure wasn't high enough, but we couldn't tell where yet. She's very small, so it's actually kind of harder to find those spaces. Had somebody else jump in the truck from Ogden to drive us down to Boone. We wanted to get off the scene and into a hospital as soon as possible because she needed imaging. She fought us with giving pain meds. We gave fentanyl, and she of course knew that fentanyl was not a good thing and people were overdosing. That was a fun time trying to explain to her that this was okay, that we knew exactly what we were doing, and she finally gave in and said okay.
There was just overwhelming, like a cloud of like calm and like you're gonna be okay and just trust with who's around you.
Once the pain meds hit, she kind of stopped fighting and relaxed a little bit, but was still talking to us. And then she begged me to call her dad.
I am a 911 dispatcher. We get multiple calls where there'll be a phone that is dropped and it'll register it as a crash.
I didn't know it at the time, but he was a 911 dispatcher in Omaha, so he knew exactly what that meant, and he knew when I wasn't saying much that the situation probably wasn't good.
Obviously, being from the Omaha area, you do not know who is responding. You do not know who was around to begin life-saving measures, or even as simple as call 911 for them to get the services.
We get to the hospital and we go ahead and move her over, give report, and clean up the truck to walk away. It was really my partner's call, so he had to do the report for it. But I was like, you know what, I'm gonna go down to the ER. She's just a little girl, and I just didn't want to leave her alone. I knew the nurses and doctors were gonna be doing what they needed to do, but she wasn't gonna have someone by her side because they were gonna be busy getting all the paperwork and doing all the imaging and all of those things. And I just didn't want to leave her alone. So since we were on second crew, I didn't have to worry about another call coming out that I had to grab, so I went down and stayed in the ER as long as I could. I helped explain anything that was going on that the nurses were doing, so she understood exactly what's happening and why. During that time, her parents did call back. I talked to them a little bit more. They had said that they heard she was flying again to the university. That was the plan, so a helicopter came here to get her. And so they wanted a little bit more details on her injuries and what she was saying, and if I could relay a message to her. So I did. I stayed with her until the flight crew came, and she said that if I believed the flight crew was the best and that it was safe, that she'd be okay with that. So she did. She did ask some questions about injuries, and I make it a point not to lie to my patients and just try to be honest and let her know, like, yeah, it's bad. I don't think you're gonna be dancing at prom. I don't think you're gonna be moving like that, but you know what, they're gonna get you back to exactly where you need to be. And she appreciated that honesty. I think I was with her for about 3 hours in total.
Very thankful for Brittany's EMT, Tammy. I believe she was the calm in Brittany's storm that day, who kept her kind of level-headed. She had the strength to help Brittany see that she was giving life-saving measures and pain control. The nurses here, they're the most loving and caring and most thoughtful people. The care didn't stop from Boone County. The minute that Brittany was flown out, it went on for months after, with calls, with texts, with gifts, with congratulating her on walking across her graduation stage. Like, the beginning to end care from this place is, I would have to say, one of the best. As a mother and being far away from your child who you know is in severe pain, knowing that she had those types of nurses and EMTs around her, and that's very, very comforting.
I remember distinctly after we had cleared the scene and second crew and third crew had both left, and we're kind of cleaning up best we can and helping out the first responders get their equipment back. I remember walking around the back of the ambulance and just kind of leaning on it. It was jarring, it was a lot of motion very fast. From the time we got on scene to the time we had lifted off that first patient, it was roughly 10 minutes. It was very, very quick. A lot happened because we had the right support at the right time and the right people doing it.
I know they were really, really good to me. The progression was a miracle. They were telling my parents they had no idea if I'd ever wake up, and then the next day it's they don't know if I'll be talking or if I'll be myself, or out of nowhere I'm up walking and they can't get me to shut up. It's just, the progression was a miracle.
You don't really think it's going to happen to you until it happens to you. You don't think you're ever going to have a serious ride in an ambulance until it is your only choice. You don't ever think you're going to need, the life flight until you do. You don't really see how much care and empathy these service workers really put into every single patient that they care for until you feel it yourself. It was the care here that made him have a chance. That chance can be taken away in literally a blink of an eye. They gave us a future back. They gave us a way to have more time with our family and our friends and to make something of ourselves because we are so young. He's going to college, he's going to make a difference. I'm going to college, I'm going to work with children.
Meeting Josh for the first time was unreal. The impact they have on our lives is uncomparable, unmeasurable.
We're very thankful for Boone County Hospital, your EMT services, the people who are on board. those ambulances that day, because I'm a firm believer without them, these two would not have made it.
I agree 100%.
So these services are extremely important for your community. Because like they said, you don't think it's going to happen until it does.